Dried out. They're still bothering me.
Okay.
Yeah.
And it was at night.
It's the season, right?
All right. Ready?
Hold on, can you give me a clap when I say?
Mm-hmm.
Yeah, okay. Yeah, and just clap your hands. One more time. And whenever you're ready.
Welcome to Georgia PTA's workshop, Healthy Air is Healthcare. I'd like to welcome Dr. Ann Mellinger Birdsong, who's with us representing Mothers and Others for Clean Air. And let me give you the context and the position statement of National PTA so that you'll better understand how to advocate for your students. Since its founding, National PTA has worked to secure adequate laws for the care and protection of children and youth, and has recognized the growing importance of environmental issues and the impact they have on the health and welfare of children and their families. PTA members have a responsibility to promote environmental health and safety and to help protect our world's finite natural resources. National PTA recognizes the scientific consensus surrounding climate change and the impact of human activities. Children represent a particularly vulnerable group, already suffering disproportionately from both direct and indirect adverse health effects of anthropogenic global warming. National PTA urges its members at all levels to monitor, support, and advocate for laws, regulations, and programs that make schools carbon neutral and energy efficient models, eliminate environmental pollutants and prevent new hazards, protect children from health risk by testing for specific hazards in and around homes and schools, and if hazards are found, by limiting exposure and addressing remedies. National PTA also urges its members to use protection and management strategies that take into account the geographic, economic, ethnic, cultural, and other societal factors that influence the incidence, exposure, and effects of environmental health hazards. And they encourage the use of renewable, sustainable energy and technologies, as well as environmentally healthy land use policies to reduce greenhouse gases and manage hazards to minimize further health problems. They also ask us to help improve the quality of our physical environment by securing and monitoring the enforcement of stricter health and safety standards for contaminants and pollutants, and reduce man-made contributions to climate change and mitigate their impact on children's health. Now I'd like to introduce Dr. Ann Mellinger Birdsong. Pause.
Okay.
Because I just realized I wrote it down on another piece of paper. Okay, where's it go?
What?
Can I turn this off for a second?
Yeah, you can go use your computer as you need to.
Okay. And
It's under your nail or something.
it's under here. Here I go. Ready?
Mm-hmm.
Dr. Ann Mellinger Birdsong graduated from the College of William and Mary and Eastern Virginia Medical School. She completed her pediatrics residency at the Hershey Medical Center of the Pennsylvania State University, and she became board certified in pediatrics and is a fellow in the American Academy of Pediatrics. She completed a Master's of Public Health in Epidemiology at Johns Hopkins University and has worked as a medical epidemiologist at the Philadelphia Department of Public Health, at the Centers for Disease Control and Prevention, at the Georgia Division and Department of Public Health, the American Lung Association of Georgia, and with Mothers and Others for Clean Air. She has worked in areas as diverse as communicable diseases, vaccine preventable diseases, radiation environmental health, environmental public health, asthma, and at county STD clinics, a county tuberculosis clinic, and a Native American Indian Health Service clinic. She is vice chair of the Georgia AAP Committee on Environmental Health and is a member of the Georgia AAP Legislative Committee. Welcome, Dr. Ann.
Hi.
Let's go back. Ready.
So the talk today is about healthy air, both outdoor and indoor air for students to help them stay healthy and to improve their school learning ability. This presentation is designed to increase awareness of indoor and outdoor air pollution and its effects on children. It will include solutions and opportunities for school districts and parents. So I want you to just up front, the big picture of air pollution is that air pollution is as bad for our health as smoking cigarettes, but we have not that much input on it. And healthy air is health care. If we could remove air pollution from the air, we'd all be so much healthier. It would be wonderful. So first I'll talk about what air pollution is and why children are more vulnerable than adults. So the two biggest air pollutions that bother us the most are ozone and particulates. And there are two kinds of particulates that we measure. There's short-term daily particulates, because you may get a spike like with a forest fire or something like that. And then there's long-term annual particulates, because that has effects on your body too, just chronic exposure over time. It's like, smoking a cigarette. If you get daily exposure as well as smoking 2 packs in one day, they will have differing effects. So ozone is made in the air every day. It takes oxygen plus some precursors such as nitrogen dioxide and volatile organic compounds, or VOCs, which both come from burning fossil fuels. And then it takes sunlight, because it takes both the heat of the day and the actual sunlight to make the reaction go and turn oxygen into ozone. And then particle pollution is just little teeny fine particles that are not a gas, but they're so small they just float on the air. And there's coarse particles, and you can see on the slide that you can fit about 5 coarse particles across the size of a human hair. And then there's 5 fine particles that are about a quarter of the size of a coarse particle. So you could fit 20 of them across a human hair. And that's still much, much smaller than a grain of sand. So here are just some photos of different particles. The one on the left is a very large grain of pollen. In the middle is from a manufacturing plant, and the bright spots are some lead that has attached that's mercury, mercury that has attached itself to this particle. So when you breathe in this particle, it goes all the way in your lungs, and you're carrying mercury in with it. Wait, go back. And then the diesel particles on the right-hand side, those are ultrafine, and I want you to look at that, because that's what comes from school buses and trucks and a few diesel cars. And they're so fine, they're what we call respirable. So they go way in your lungs all the way to the air sacs at the end, and then they just cross straight into your bloodstream. So whatever is attached to the diesel particle gets in your bloodstream. And this is an example of particle pollution on a day when there was wildfires in North Georgia and Tennessee, and it was a sunny day, full sun, 3 o'clock in the afternoon, but you can barely tell that the sun is there because there's so much smoke. And children are more vulnerable because they spend more time outdoors than adults. When they are outdoors, they run and play hard. They don't just sit on the bench or go for a nice low-key walk. And they also, just because of being children, they breathe more air for their body size than adults do. And again, 80% of a child's lung growth occurs after they're born. And even into the teen years, you know how teens go through the growth spurt, and their rib cage gets big and their lung grows just as much to fill up the growing rib cage. So this is a summary slide of the health risk of air pollution in kids. It affects their lung growth. It causes asthma attacks. It can cause asthma itself. It causes preterm birth and low birth weight. It causes cognitive and motor delays, and it affects their school performance. So this is a study done in Southern California as they cleaned up the air. So it shows the final lung volume in kids. They measured at the beginning when they were 11 and again at the end when they were 15. And so the two red circles are for children who grew up when the air was polluted, and you can see their lung volume is smaller, whereas the two blue circles are children who grew up 10 years later when the air had been cleaned up, and their lungs are about 200 cc's bigger, about 10 to 12%, just from the air having been cleaned up. And that's for both nitrogen dioxide and particulates. Other effects on children with asthma that are in polluted areas use more medicine. They go to the emergency room more often. They're hospitalized more often, and they have more school absences, which affects their learning and may affect, if they fall behind, they may have to repeat a grade or choose a career that's different because they haven't been able to keep up because they missed too much school.
They call those frequent flyers at some hospitals.
Yeah.
They come to the hospital so often.
Say that again, please.
They call those frequent flyers at some hospitals because they come to the hospital emergency room so often.
Yes. So air pollution can also cause new onset asthma in children who didn't have it before. Children who live near busy highways are more likely to have asthma than the ones who live far from the highway. And children, this is teenagers that play 3 or more team sports in a year that are outdoor sports like baseball and soccer and football.
This is why it's important that we site schools away from air pollution sources like highways.
Yes. So other things that air pollution causes, because it damages the lining of your airways and your lungs, you get more viral infections after a spike or even with just long-term exposure, such as flu, and one, the RSV is what everybody calls it. It's respiratory syncytial virus, but that's the longest even doctors just say RSV. And also COVID. There are a lot of studies showing that there's more COVID infections, and the people who get it are more likely to die in high air pollution areas. That's both in the United States, in Europe, and in Asia, and India.
This is an environmental justice issue then?
Yes.
Okay.
And yes, going back, I don't have a slide on this, but there are a lot of studies that show that exposure to air pollution is differential by different race groups because of where we put highways and factories. We put them more in black and brown communities, so there's more exposure, especially to particulates in communities of color.
That's a problem.
So this is another study that was done here in Georgia, in Atlanta, during the Olympics. They scared everybody out of town, and they had shuttle buses for all the athletes. There was much less ozone and much less particulates, and they compared hospitalizations and emergency room visits for asthma compared to like broken bones and finger, and the asthma went down 11 to 40%, whereas the broken bones and fingers stayed the same. So they know that the decreased air pollution made the kids healthier for that 2-week period. And
Amazing.
then once we went back to normal, it went right back up.
I wonder if the same thing happened when people stopped driving to work and we worked virtually during COVID. I know the air quality got better.
It did. So, and then this is just for adults because kids become adults and the damage that the air pollution does continues on. So adults can get asthma and emphysema. It causes strokes. It causes dementia and other cognitive problems. It causes heart attacks and arrhythmias. It also increases adults' risk for viral infections like flu and COVID. It causes increased deaths from all kinds of causes. It causes lung cancer and other kinds of cancers, just like cigarettes cause lung cancer and other kinds of cancers. And there's new research coming out that shows that it's associated with kidney disease and the need for dialysis, which to me makes perfect sense because the kidneys filter your blood, and if you've got particulates in your blood, the kidney traps them, and then they're there damaging the kidney.
Wow.
So this is just an overall view. In the United States, 13% of all deaths are from fine particulates, which we call PM 2.5, from fossil fuels. 1.6% of all deaths in the U.S. are caused by nitrogen dioxide, which we mostly get from burning fossil fuels. And there are studies that show that ozone is as bad for lung disease as smoking a pack a day of cigarettes. It has the same effect on emphysema as smoking a pack a day. So, and then this is from the EPA, and it's just to show that our GDP has gone up and our economic output, our vehicle mile travel and population has gone up, but we've cut air pollution, so it hasn't hurt, you can see the dips from the recessions, that's what hurts the economy, but our economy is going gangbusters despite all the pollution controls we've been putting on for the last 20 years.
So they don't put brakes on economic development
No.
when you have clean air strategies.
Right. I actually think because it improves adult work performance too. There's fewer days missed work, there's fewer days missed school. Parents don't have to take off work because they're not staying home to care for sick kids.
Right.
So it actually is better for the economy to have clean air.
And kids test better too.
Yes.
So outdoor air pollution and students' health. Let's talk about that.
Yes, especially due to diesel buses, which is here. So diesel exhaust contains carbon particles, otherwise known as soot or black carbon. It contains at least 40 kinds of toxic chemicals, several of which we know are carcinogens and the rest we suspect are. It contains arsenic, benzene, and formaldehyde, which are known carcinogens. In the United States, there are a little over 500,000 school buses that transport 26 million students every year, and 94% of all school buses are diesel.
Oh.
So measurements inside school buses show that the air pollution levels are 4 to 15 times higher than outside the school bus or in a car just in front of the school bus.
So the health risk of air pollution for children from diesel exhaust.
Yeah, so diesel exhaust causes asthma attacks, it causes respiratory problem, it damages children's and teens' lung growth because of all the particulates it makes. And in Georgia, at least one student has died from an asthma attack caused by waiting next to the diesel buses that were turned off, they were idling with their exhaust coming out, and it triggered an asthma attack so bad the poor kid died.
A long time ago, and we could do this again, Georgia PTA worked with Mothers and Others for Clean Air to develop a wonderful program about idling around schools. Many parents pick their children up themselves in their car, and we had signs up in the parking lots talking about don't let your car idle because you're creating pollution in that air that children are walking through.
Yes. Okay, and then this next one is more about diesel exhaust. It was a study done by Georgia State here in Georgia, and they looked at counties across the whole state, not just the Atlanta area. They looked at how much percent of the students rode the school buses, what percent of the school bus fleet had been put these special filters on to help reduce some of the pollution, and then they compared their fitnessgram tests and their English and math test scores. And they found that, and then they put them all together. If a school or a county system was able to retrofit and put the filter on 100% of their buses, there would be a 4% increase in average aerobic capacity for every student in the district, which to me is huge because that means that, some kids got a lot more and some, but to change, you think of Gwinnett with 100,000 students and you get 4% better on 100,000 people. That's a huge change.
But most parents would be happy to hear that their English scores improved by 1/10 of a standard deviation. That's the same change that happens with a teacher that has 5 years experience compared to a new teacher.
Right, so just making better buses is
made a difference.
Yeah. So then this is a study done in Florida, but we would expect it to be the same everywhere. They followed kids as they went from elementary to middle school or middle school to high school. So it was just the normal switch. It wasn't that the kids switched schools because they were having problems. And they looked at students' test scores and behavioral problems. And they looked at whether the new school was downwind or upwind from a major highway. So they only looked at the schools that were within 0.4 of a mile and whether it was upwind on the upwind side or downwind. And they found that if schools went to a school that was downwind from a highway, this is a student that had had good test scores before, their test scores went down, they had more behavioral problems and more absences, just from the switch to a
Location.
different school.
So citing schools is a very important element that can affect student performance.
So here are some maps of school districts. I have Savannah and Macon and then Morgan County, which is not a big city. And you can see that a lot of schools in many counties all around the state are near highways, which is convenient for getting in and out of the school, but it's not good for the students' test scores.
Mm-hmm.
So now we'll talk about what solutions do we have, since we know that it's such a big problem. So we can go to electric school buses. They make no exhaust, and they're good for health, and they save money on maintenance over the lifetime, but there is a big upfront cost because they cost more to buy. Electric school buses will improve student performance. Their health will be better. We'll all save money on healthcare costs. The school system will probably save money on teacher healthcare costs. And the new jobs plan that's been proposed has $25 billion in it to help with electrifying school buses. Their goal is to get 20% of every county's fleet to be electric, which would be such a boon to students' health and to the whole community.
We have good news here in Georgia. We have Bluebird, which is a company that makes school buses. They're actually doing retrofitting of electric school buses from diesel. And we do also have, in Fulton County, the first electric school bus that's been purchased. And even more important than that, it was just announced this week on Georgia Trend that a Dutch company is moving to Atlanta, their headquarters, in order to set up electrification stations for our total transportation needs to move us toward electric school bus stations throughout the state and other great things.
And I do want to point out that not just the jobs plan that's been proposed, but there's already DERA, D-E-R-A, or the Diesel's Emission Reduction Act, has cycles every year. They award county school systems money to clean up their school buses. So you can get your county to talk to, it goes through EPA, and you apply every year. It's announced in the spring and they give it out in the fall. So come next fall, talk to your county school board about applying for these funds to get cleaner buses.
So purchasing of school buses is done on a system-by-system basis, not necessarily county by county. So every school system that has a board of education has choices to make about how they purchase items like school buses. So as they get ready to upgrade their school buses, which is done with a combination of state and local funds, they can make choices, along with these grants that are mentioned, to improve the overall air quality at the same time.
Yes.
Just pause real quick. Dad, you need to get something out of the kitchen? No? No, I thought I heard him rustling in the kitchen. Okay.
I'll read this
So
one.
there are things, Mothers and Others on its website. We have our Schools for Clean Air and Take Action, and we have a list of things that you can do. You can write a letter to the editor of your paper about the health benefits of electric school buses. You can give a presentation to your school board about the benefits of electric school buses and how much better it is for both student health and student performance. And you can work with your school district to use DERA and the other, hopefully, new funds to buy electric school buses. And it will make such a boon to students. And it will also help everybody's health.
And while you're at it, you can also talk to your school boards and decision makers about citing schools. You can do that by asking to meet with the board, actually testifying at board meetings. They have usually an audience opportunity to speak. EPA has a school citing guidance document, which we're going to put a link here for you on this slide. And Georgia Conservancy has a program about school location. We have a link to that as well. And Georgia Conservancy also conducts workshops. We have a contact for you Catherine Moore at georgiaconservancy.org. Her email is in this. And while we're at it, during this talk, you can have a conversation with us and we can answer your questions by simply putting them in the chat. If you have other questions, you can always contact us after this workshop.
So now we'll move on to indoor air pollution and students' health. So indoor air in schools is a little bit different from the outdoor air because the schools are usually the windows are closed and it's sealed off and there's things in the school that aren't outside. So cleaning products, furniture, carpets, flooring, if there's any mold or mildew, if the school uses pesticides, what the walls are painted with, depending on the soil, there may be radon issues. And then if anybody, well, all the schools now are smoke-free, but I remember when I was a kid, when you walk by the teacher's lounge, it would be billowing out clouds of cigarette smoke. But now the vaping is a big issue because the kids think they can hide it, and it's not as obvious as cigarette smoking. But that can affect everybody's health, not just the kid doing it.
During COVID, we've learned how important air ventilation and filtration is to school buildings. So money has been put into the infrastructure on that issue alone, but that benefits us overall in our schools, improving the air ventilation and filtration.
Right. So now we'll talk about the specific things. Cleaning products can release volatile organic compounds, or VOCs. It can release ammonia compounds, formaldehyde, and other chemicals. And all of these can cause coughing, irritation, headaches. It can trigger asthma or allergy attacks in people who have asthma or allergies, and set off eczema too if they're allergic. Formaldehyde is a known carcinogen, so if people breathing that over a while, it can cause increased cancer risk. And then, do you want to?
Yes, so Mothers and Others for Clean Air has collaborated with Georgia PTA as well as EWG to come up with a list of safer cleaning products for schools. We also have some links to green schools. One of the important things about becoming a green school is that you monitor the cleaning products that are being used daily to clean your school. Cleaning is more important than ever now, especially as people become very cautious about germs and viruses and so forth, and realize that a clean school is a benefit to students.
Yes, we want them to stay safe from viruses and, be healthy that way, but we don't want them to be getting affected by the cleaning products. So there's
a very
use good products,
right.
Keep them safe.
Careful choices need to be made.
Yeah.
If you've ever walked by the janitor's closet, you'll look inside and sometimes you'll see large containers and vats of liquids with no description on them whatsoever. That sometimes is a cleaning product, and you need to know what those are in your school. You have a right to know.
All right, now we're moving on to furniture and carpets because they can release similar things. Formaldehyde can come from plywood, particle board, press board, some flooring, and adhesives that are used to glue it down. It can also, like furniture that's particle board. They also can make VOCs. Vinyl floors can release dioxin because that's a breakdown product of some of the chemicals used to make vinyl.
Especially the glue that they use to put it down.
Furnitures and these chemicals can cause coughing, irritation, headaches, asthma and allergy attacks again, and also increase cancer risk because of the dioxin and formaldehyde. So what your school can do is choose safer adhesive. There are solutions available. There's a carpet mill in Dalton that makes environmentally friendly carpets. You can buy furniture at the end of the school year and let it sit around so that most of the bad chemicals come off in the first month or two. So if you buy it in June and it sits around till August when the kids come back, then a lot of it will have gotten out of the air and the kids won't be breathing so much.
Many schools take the summer months to do total redos of their buildings, and that's when a lot of painting is done and a lot of purchasing of materials and equipment and furniture. So the recommendation is very important. If they purchase new things and they only have them a week before school starts, the chemicals that are being produced, the VOCs, can be very detrimental to the indoor air quality.
So buy it in June and let it sit around for a month, 2
Okay.
months. All right. Then we're moving on to mold and mildew, which tend to occur if there's like roof leaks or cracks in the wall and the water gets in, or dripping faucets, or a place where the water fountain squirts too much and it always stays wet. Um, and so mold and mildew can cause allergens. The spores get in the air. Some of them actually make toxins that are bad for our health. It can really be bad for people with asthma or allergies. It can trigger bad attacks. And some people that don't have asthma or allergies, you just feel tired all the time and you get headaches.
This can be true at home as well.
Right. So what you can do, have the school fix any water leaks, get their roof in top shape. If you see where the gutters are maybe dripping in and one room has gutter drip, fix that. And the best thing to do is to just scrub it and get rid of the mold. If it's on a wood surface or something porous, you might have to replace like if it's part of like wallboard or something like that, you might have to replace a section of wallboard, but that's good. If you've actually had a flood or like a boiler leaked and furniture or carpets got wet, then you'll probably have to replace the whole carpet. And you may, if it's been a bad water event, like a boiler flooding several rooms, you might need a remediation company that can do a professional job.
So pesticides.
Quick pause. I got about 20 minutes left of battery.
Oh,
Okay.
Got 20 minutes.
All right.
It's only been 30
Where'd my battery pack go?
seconds.
It's over here. We'll wait till we get to
Oh,
that
it's
problem.
dark down next to you on the floor there by that.
Over
granite.
here?
Yeah.
Oh, okay. This one.
Yeah.
Ah.
So that just plugs in that on the back.
Okay.
Yeah, right there. And then it'll take over.
I'll talk about pesticides for a second. For a little bit.
All right. I'll put this. Yeah.
Ready? All right, so pesticides can release VOCs and formaldehyde, and they can cause nausea, irritation, and burning to nose and eyes, dizziness, headaches, and tingling. Your school can use the EPA's integrated pest management. We have a link here for you to use the toolkit. If possible, choose safer alternatives such as boric acid.
Right. Then we have paints. Some paints can make VOCs, formaldehyde, and there are additives added to make the paint either mold or mildew resistant or stay better or not lose its color. Some of the older schools that are more than like 40 or 50 years old could still have lead paint. And the VOCs and the additives, the off-gassing from the paint, can cause asthma attack, allergies, headaches, and again, formaldehyde is a carcinogen, so that increases the lifetime cancer risk. So what the school can do is there's a green seal that certifies paints as to being low VOC and low gas producing, and use latex paint even if you can't get the green seal, because latex makes much less VOCs than oil paints.
And then there's also the issue of radon. If you've sold a house, you know that the radon test is one of the things that is required. Radon is a naturally occurring radioactive gas that forms as a breakdown product from uranium as it decays. All soils release radon, but the amounts vary. It gets in through the cracks in the walls and around water pipes and through concrete floors. Radon can cause.
Radon is the second leading cause of lung cancer in the United States because you're breathing in this radioactive gas and it's damaging your lung tissue. It causes lung cancer in both smokers and non-smokers. So it adds to the risk that smokers already have from the cigarettes. And I just want to point out, we have a map here of the areas that have measured higher for radon, and it's all parts of the state. It's especially stronger in the northern part where the mountains are. But
Actually, around Stone Mountain is very high.
yes,
Mhm.
where there's a lot of granite, because granite seems to have more uranium in it. But it gets in the soil, and you can see on the map, even across South Georgia, there's counties that have more than average.
So your school can do something about this. First of all, they have test kits for radon, where you can simply hold the little box in a place for a few days and then mail it off and it'll be checked for radon. The school system needs to consult with the state radon program
If it's high,
if it's high.
because you need a certified mitigator and it's complicated, so it's not just something the school system.
Let's talk about indoor air.
Yeah. Okay, so indoor air with smoking and vaping now. So smoking makes nicotine, it makes soot, it makes particulates, it makes VOCs and carbon monoxide from the smoke, and those are all bad for our health. It causes asthma attacks, lung and other kind of cancers, and the nicotine is one of the main causes of heart disease. It affects every organ in your body, not just your lungs, but you breathe it in, it gets in your blood, it affects your brain, your skin, your kidneys, everything. And then vaping also releases nicotine, because that's the chief point of vaping, is to get the nicotine without the soot. It doesn't have as much soot, but it still makes VOCs and particulates, and then because of the flash of electricity on the metal platform, it vaporizes some of the metal, so whoever vapes is breathing in a little bit of whatever metal the platform is made out of. So it also, because of the nicotine, causes heart disease, and then the other chemicals and the heavy metals can cause lung problems and other concerns. And you're just as addicted to nicotine, whether it comes through the vaping or the smoking.
So we
Yeah.
have passed some legislation around vaping in Georgia, but more needs to be done. What your school can do is smoking cessation programs such as the AAFP, Tar Wars, and there's a link here for you.
That's designed especially for teenagers, so it's really good. All right, and then now we're moving on to other solutions for outdoor air pollution, to talk about what the school kids and the children and you can do when the air quality is showing that it's a yellow or orange day. So the air quality index is something EPA has come up with to help convert all the numbers from the different kinds of air pollution into an easy guide. The air today is yellow, or the air today is green or orange.
And the weather station, Weather Channel, oftentimes puts that information out.
Yes, and you can get alerts. And so I just want to explain, because of the damage that both ozone and particulates do to children's growing lungs in terms of causing asthma or damaging lung growth or etc., all children, whether they have asthma or not, are considered a sensitive group because it's so bad for their lungs. So on either kind of high, whatever reason we have for the high air pollution alert,
Look out for
children are
red and
sensitive.
yellow and orange, right?
Yes.
Those are the bad ones.
And children with asthma are even more sensitive than normal, regular children.
So the air quality index is called AQI.
So where can you find out your air pollution? So you can sign up at EPA for an email that will send you an email on days there's an air pollution alert. That's EnviroFlash, and we give that to you. There's the EPA website called AirNow, which I took a screenshot of a map of Atlanta on a particularly bad day. And that's airnow.gov. And Georgia EPD has an air monitoring program, and you can look up your city and see results for the whole year. And our Mothers and Others website will soon have a clearinghouse of resources for that too. All right, these are all smartphone apps, so if you want to look at it while you're going out and about. EPA has an AirNow app that works on both Android and Apple systems, and that to me is the best one because it's the most up to date. The other ones all use EPA data and they're an hour or two behind. The Weather Channel will put an alert at the top when it's a code orange day, and we'll put it on their main screen, and if you scroll down about 6 screens, you can look up and see which air pollutant is the problem. Apple Maps is putting it in the bottom corner next to the temperature if there's an air pollution alert. I haven't seen that on Google yet. Hopefully they'll come through. And then for teenagers, there's one called Should I Smoke? And it just makes the teenagers giggle. It converts the numbers into this is the equivalent of half a cigarette or 2 cigarettes or whatever. So it's good especially if the teens have asthma, to get them to use that.
There are some strategies you can use to avoid air pollution. One of them is to exercise before 2 p.m. or after 8 to 9 p.m. or indoors when the ozone levels are high. Another one is,
For particulates, those tend to be high all day, so when it's a high particulate day like the forest fire day, just exercise indoors, because you don't want to just sit still and not do anything. That's bad for your health too. So you can do strategies so you still exercise but avoid the ozone or particulates. And then at all times, you don't want to exercise near a busy highway like Lawrenceville Highway. You can't exercise along interstate, but the U.S. highways or the big state arterials, you don't want to be running or biking alongside the side of the road. And then another thing is energy conservation, because the less energy we use, the less power plants are working and we're not making as much pollution. So that's like an instant not using fossil fuels. So that includes weatherizing, such as caulking windows, insulation, maybe even if there's single pane windows, replacing them with insulated windows, turning off lights and computers at night as much as possible if you need a computer to run business files or grade reports or whatever. Leave that one computer on, but turn off all the rest in the school. And then fix leaky faucets, because it takes energy to make the water clean, and if you're dripping it away, that's just like energy going to waste, as well as creating a risk of mold.
so tell me about the Planet Prescription film. How can schools sign up to see that?
Oh, yes, we have a documentary movie made that on our website. Look for Planet Prescription, and you can sign up, and it's a 20-minute documentary, so it's not very long, and we can do that for your PTA, and then you can have me or someone else be live by Zoom or maybe eventually live in person and answer questions after the film is done.
So schools can become more green, and you as parents can be part of the solution to help your children be healthier, especially children that are at risk with asthma and other diseases. You need to be careful about all of the indoor and outdoor air quality on any day, but kids do perform better, do better tests, and are healthier overall when we pay attention to air quality.
Yes.
So healthy air is health care.
Alrighty. You guys want to do the last one real quick again? I'll get a close up
Okay.
of both of
Okay.
you saying it.
All right.
So go ahead and say it well.
So healthy air is health care.
Alright. And my doctor. Yes. Say it one more time. Last time.
Healthy air is health care.
Great. And I got that as like 3 shots now. So
Okay.
that's good.
Giggle.
Alright.
Giggle. Okay,
Is that it?
how much time was that?
That was about 40 minutes.
Okay, good. Because we still have,
10
We
minutes for Q&A.
yeah, all right.
That was what I was aiming for.
Yay!
Oh, I was
Give a
aiming
quick
for
clap
35.
for me. Alright. Perfect. And let's go. Alright.
Great job.
Good
And
stuff.
we're
It's
better
fun
at
doing it as a
improv.
team.
Yes. Well,
I
I was
like it
trying
much
to,
better than being all myself.
I didn't
'cause
want to interrupt.
I liked how you jumped in and did some
I
of
didn't.
it.
I hope I didn't do it too much, but
No,
I
that's
just
good.
if you change the voice, you keep their attention because people turn,
Yeah, you go like that.
especially on virtual. So if you have a little interruption or they see something imperfection actually
It's like
gets their
having
attention.
moving visuals.
Yeah,
It's like nice
like a
when
real
he's
class.
doing it, like, because I can use my hands and
Mm-hmm. Yeah.
that keeps people going.
I
Now-
also would I switch the camera angle to, between a 2-shot of
Uh-huh.
both of you. To
Or one.
Just you, Ann, or just Mom. And
Yeah.
on the questions.
Moving that around actually changes the focus.
Right, so
yeah.
that's cool.
So the thing is, there's a trick you learn in film school. It's called an insert cut. An insert cut is like
Oh,
the
so when
moment when you're talking and I'm trying to fiddle, to frame you up nice. And all I have to do is I use your audio. I just put the slide right over it, so you don't really see it. So
See, that's how the slides are going to kind of come in.
yeah, because they need to see
They're like
the
a
slides
sandwich.
have
Mhm.
information too.
And I also tried to sometimes frame you a little bit on the side, so I could also put the slide and then have you talking to it next to it too.
You can do both ways.
Yeah. So I
Yeah,
have
so it'll be. You're gonna do all this like tonight?
Well,
For tomorrow?
I'm going to tell Ty to
Probably
give us a
by
little more.
tomorrow, yeah.
I'm going to
Because
ask
due
Ty for
tomorrow,
more.
right?
Yeah, but